For our Capstone project, we did our research and education on non-pharmacological interventions for neonates undergoing neonatal abstinence syndrome. We presented our findings to nurses in the Neonatal Intensive Care Unit at Cincinnati Children's Hospital. Our group members are Brittany, Sarah Adams, and Kyaia Bacon. The purpose of our Capstone project was to improve the knowledge and ability to implement non-pharmacological interventions in nurses caring for patients with neonatal abstinence syndrome. We wanted to educate nurses on the importance of non-pharmacological interventions in order to help improve outcomes for infants undergoing neonatal abstinence syndrome. More specifically, we wanted to educate nurses on which interventions are the most helpful and how to implement these interventions in an effective manner. Neonatal abstinence syndrome is still a prominent issue. In fact, every 15 minutes, one baby is born with a diagnosis of neonatal abstinence syndrome. The prevalence in the United States remains incredibly high, and continued action is needed to improve the outcomes of these newborns. The graph above shows that the problem, specifically in the state of Ohio, continues to grow each year as the opioid epidemic continues to rise as well in our state.
Throughout our nursing careers in clinical and co-op, the majority of our group members have encountered a pediatric patient experiencing NAS. Providing this direct care is what inspired our project problem. From here, we created our PICO question, which states, in nurses who provide care to infants experiencing NAS, how does education on non-pharmacological interventions, compared to no education on non-pharmacological interventions, improve knowledge and ability to implement non-pharmacological interventions in nurses? We researched numerous articles on databases such as EBSCO, CINAHL, and PubMed to find high-quality evidence-based literature on our topic. We took it a step further and examined current policies at our local children's hospital. As a group, we compared our findings and were able to assemble an educational video that emphasizes the best non-pharmacological nursing interventions to implement with these patients. We presented our project to nurses at Cincinnati Children's in the NICU setting. We asked them various questions about non-pharmacological interventions, such as breastfeeding, swaddling, prone positioning, rooming in, skin-to-skin, music, and low-stimulating environments. We asked them to rate their knowledge on these topics from 1 to 5, with 5 being an expert on the topic. On the pre-test, the average was 3.75 to a 4.8, and on their post-test, the average was a 5. Some challenges we faced while administering our education session was, since it was a virtual presentation, we had to send out some reminder emails letting the nurses know that they do have this education available. And we did anticipate this because we know that nursing schedules can be unpredictable and very busy.
Prior to our presentations, nurses felt as though they had a strong knowledge of each topic regarding the interventions. However, after our presentation, the nurses found that they were experts in each topic presented after receiving further education. Overall, the nurses found the presentation to be beneficial in enhancing their knowledge on how to care for the neonates undergoing withdrawal symptoms. Going forward, our project can start new conversations at the workplace and lead to a change in policy for taking care of neonates undergoing withdrawal symptoms. This project can lead to nurse unit educators enhancing the education program at the hospital to include topics that we touched on so that neonates are better taken care of and have less severe symptoms of withdrawal. Here are our references.